Don't forget to subscribe to the MFine channel and hit the bell icon to never miss any update.
The first thing is the most commonly known and the most popular symptom, the chest pain. Now, if somebody has a chest discomfort, which could be a squeezing sensation, or could be a heaviness in the chest, or it could be a burning sensation, or a pressure, or some heaviness or a weight put on the chest, any of these symptoms indicate or make one suspicious of an impending heart attack. Now, typically, the patient folds his fist around his middle of the chest with a very anxious look and with a sweat all over the face. Now, this discomfort can be anywhere from the angle of the jaw and could go down as low as the umbilicus or the navel. It could be in the both arms or the back or the chest. Now, the second symptom is the same kind of chest discomfort or pain on effort. The patient is walking up the stairs or walking a particular distance, particularly if he's walking up incline, and he feels these symptoms, these are indicative of an angina. Now, this distance is typically constant. So, for example, he is walking up 200 meters every day and he feels the same symptoms. So, these are indicative of a decreased blood supply to the heart or an angina. Now, both the heart attack or a myocardial infarction and angina or the chest discomfort on effort, these two should be suspected, particularly if the person is above 45 years of age, smoker, has diabetes and hypertension, or a family history of heart attacks. So these should make one suspicious of these symptoms much more than the others. The third symptom is breathlessness. Now, patients with cardiac symptoms, cardiac problems can have breathlessness on effort. They walk and they feel short of breath. They sit down and the breathlessness vanishes. And this is again consistently there. One should suspect that either if they are having a decreased blood supply to the heart or a weak pumping of the cardiac muscle. Now, these symptoms of breathlessness are much more important, very important in fact. If the person has breathlessness on lying down and on sitting down, they vanishes. This is very typical. So in the middle of the night, he sleeps normally, but after 1 or 2 hours, suddenly gets up with cough or breathlessness, again sleeps, again 1 or 2 hours, again gets up. This cycle goes on. And so much so that after some time, the patient realizes that he puts 2 or 3 pillows and sleeps in a semi-up recumbent position, he feels far more comfortable. So the lying down position, if the cough or breathlessness comes, is very indicative of a cardiac symptom and should make one go to. This is different from an asthma where a person has breathlessness suddenly on even sitting down also. It's not necessarily on lying down. Next symptom is palpitations or a fluttering of the heart. Normally the heart rate is 60 to 70 per minute. When we walk, it can go up to 100 or 110. But sometimes without doing any exertion, just sitting comfortably in a chair or in an air-conditioned room also, the heart rate from a normal of 60 to 70 suddenly jumps up to 150 to 200, and the patient feels like a train is running in his heart, and this is called as a palpitations. This is very indicative of an arrhythmia, and these palpitations sometimes they vanish on their own after a few minutes, or they can last even up to half an hour, 1 hour, or until the patient reaches a hospital where he receives an injection and it subsides. These palpitations can be associated with sweating or dizziness, but not necessarily so. So these are indicative of arrhythmia and they must require evaluation. Now, the last symptom is a loss of consciousness. A brief loss of consciousness is sometimes very important sign of a dangerous condition called an impending cardiac arrest. Now, if a person loses a consciousness even for a few seconds, or less than a minute, and he spontaneously gets up and he doesn't know why he fell down. Now, particularly if he has two underlying conditions, either he has a heart attack in the past, like 3 years, 4 years, 5 years back he had a heart attack, or if the echocardiogram shows that his pumping of the heart muscle is low or ejection fraction is low, as it is called technically. So weak hearts or low pumping hearts or an old history of myocardial infarction, if these two things are there, if a patient loses consciousness even for a few seconds, these are indicative of an impending cardiac arrest. The second time it could just be a sudden cardiac death. So if these happen, these people must approach the hospital as early as possible for further evaluation. So, in short, in summary, if a person has chest discomfort at rest with sweating, or chest pain or discomfort on exertion, breathlessness on lying down, palpitations, and loss of consciousness, particularly with a history of heart attack, these are the things that tell you your heart is not right.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.